Hello, everyone. This is Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we talk about Lyme disease. No 2 weeks are ever the same because you create each of these webinars with your questions. Tonight, I look forward to seeing what you have in store for me. It's always something a little bit different each week. The way that you participate, if you're new here, you can participate two ways. You can actually listen to some of the questions and the responses I give, or you can actually write your own questions. And the way you do that is over here on the right-hand side of the screen, down there at the bottom, is a chat box, and you can write your question to me there. The only thing I ask is, as you're writing the question, only hit the enter key when the whole question is complete. Each time you hit that enter key, it sends a separate question to me, which gets to be a little hard for me to follow from this side of the computer. Tomorrow morning, somewhere around, probably around 8:30 to 9 o'clock, actually, make that more around 9 to 9:30 Seattle time tomorrow, I will be sending out an email that has information about how to watch the recording that I'm making tonight. So yes, I am making a recording. And if you happen to miss it, you'll be able to listen, or what I say here tonight, you'll be able to listen tomorrow morning to get more information. In that recording tomorrow, there will also be a sign-up link for the next series of webinars. So this is our last one for this month, and then I will be taking next week off, actually. So the first week in July, we'll be taking off. But then we'll do 3 more in July. So next week's off, and then we'll do 3 in a row. So look for that email tomorrow morning, which will have the link to sign up for the next series of webinars. If you happen to miss getting that email, I do post the recording on the homepage of my supplement store, which is Marty Ross MD supplements at treatlyme.com, and you can find that towards the middle of the page there. You can also find it on the webinars page at treatlyme.net, which is my Lyme disease information site, also known as Treat Lyme by Marty Ross MD. And then finally, you could find it at my clinic website on the homepage. I post it there as well. And my clinic website is martyrossmd.com. It's a lot of websites. Anyhow, oh, one last thing. During the webinar tonight, I will be reading your questions so that everyone can hear them. Realize if you're participating in the live version, though, you can actually read them on your screen because I will be posting that question so that you can see it. If you are listening in on the recorded version, however, the written version does not show up on your screen, and for some reason just doesn't show up in the recorded versions, okay? All right, so without any further ado, let's go ahead and get started here. And my plan is to do this for an hour and a half tonight, roughly. If I happen to get tired before then, sometimes I do end up a little bit early, but that's not that often. So we'll see how I hold up here today, okay? All right, let's go ahead and post the first question here. All right, this is a question from Sita. Let's see, I've been using Otoba and Casclaw for about a year. You said these herbs aren't useful for Ehrlichia, Anapalsma, Rickettsia. In case I have any of these 3, is it too late to start treating now with a month of doxy if the initial infection was over a year ago? Also, how do you discern if lightheadedness is due to POTS or due to adrenal dysfunction and mineral corticosteroids? Okay, let me talk about that first question. So there are good herbal antibiotic approaches to 3 of the tick-borne infections that we treat here. So Lyme, there's Otoba and Casclaw works about 85 to 90% of the time. It's about as successful as prescription antibiotics. For Babesia, there's artemisinin and cryptolepis can work fairly well. And for Bartonella, you can use Sida acuta and Hutania, and they work fairly well as well too. Okay, but when it comes to Ehrlichia and Anapalsma and Rickettsia, generally I have not found a good herbal option for those. And so the way I like to treat that is with doxycyline. And doxycyline, for those for a month, should be sufficient to get rid of them. And generally it is pretty easy to get rid of those with the doxycyline. In other words, treatment works successfully with those. We don't run into the problem we do with Lyme, where sometimes the doxycyline doesn't work well enough, okay? So you can add it at this point. You haven't missed the chance to get benefit from using the doxycyline for those infections. And so that's what I would do. And you can even add it while you're still taking the Atoba and the cat's claw. You don't necessarily need to stop those while you're on the doxycyline, okay? All right, then the other part of your question. So POTS, everyone, stands for postural orthostatic tachycardic syndrome, okay, POTS. And what it basically means is that your autonomic nervous system, the part of the nervous system that regulates your blood pressure and your heart rate and even your digestion, that's called the autonomic nervous system. It has chemicals in it like adrenaline and anti-adrenaline. There's a nerve that controls that called the vagus nerve. And sometimes in people with Lyme, there can be dysfunction of the vagus nerve because it either gets infected by the Lyme germ, in which case it just won't work correctly, or sometimes as a result of having Babesia in you, the co-infection Babesia, that can cause some dysfunction in how the autonomic nervous system works as well too, okay? All right, so typically symptoms you're gonna have with POTS are going to sometimes be that you're going to get blood pressure dysregulation. So as you stand up and your head goes above where it is, one of the things that keeps us from getting dizziness when we stand up is our blood vessels squeeze down tight to push blood up. And so as we go up, the blood stays in our brain, okay? But if you have autonomic dysfunction, you have dysfunction of the vagus nerve and the adrenaline, anti-adrenaline chemicals, the blood vessels aren't signaled to squeeze tight. So what happens is as you stand up, you get low blood pressure to the brain and you get dizzy and lightheaded, okay? Other symptoms that can look like POTS, though, would be periods of sometimes with POTS, you're going to have periods where you get surges of adrenaline. That can give you a lot of headache problems up here in the front of your head. Other symptoms of POTS can be periods of sweating that you can get. And POTS often just at random, you can get periods of racing and skipping of your heart that have nothing to do with standing, okay? On the other hand, adrenal dysfunction can sometimes result in low blood pressure that is primarily going to be an issue when you try to stand up. Just when you stand up, you're not going to have all these other symptoms of heart rate variability where it's racing and skipping sometimes. You're probably not going to have the headache problems with just the problems that you get from adrenal dysfunction causing low blood pressure. You're not going to have those other symptoms that I was talking with you about, okay? All right, so what happens with adrenal dysfunction and how that relates to blood pressure is your adrenal glands make a number of chemicals. They make cortisol, which is a steroid. It's a good steroid in the right amount. It helps your immune system work well and gives you energy, okay? And the adrenal glands also make a number of other chemicals called mineralocorticoids. And the job of a mineralocorticoid is to tell the kidneys to keep more minerals, including sodium, held within our bloodstream. And wherever there's a lot of sodium in the body, water is attracted to those areas. And so if you have a lot of sodium in your blood vessels, that causes more liquid and water to be held within the blood vessels, which expands your blood volume so that as you stand up, you have enough blood volume to go up with your brain and you don't get lightheaded, okay? But if you've got adrenal insufficiency, sometimes what can happen with that is your kidneys aren't holding enough sodium so that as you stand up, there's just not enough blood volume to go up with your brain and you can get lightheaded and dizzy from that, okay? So I hope that gives you some information there. And thank you for that question, Seta. Let's see here, there we are. Let's see, next question is from Tim. Hi, Tim. Let's see, hi, Dr. Marty. Thank you so much for always taking my questions. You're welcome. Let's see, it is, I was wondering how important it is to reach the target dosage based on weight for disulfiram. I gained a lot of weight due to being in bed a lot. According to your website, my target dose is 750 milligrams. My ultimate goal is to reach that dosage, but if I don't make it that far, would a lower dosage still be capable of getting rid of Lyme? Thank you again. So the answer is, yeah, I could. So in terms of this targeted dose that we've come up with for disulfiram, the truth is we don't really know. No one's done enough research on people to know what is the ideal targeted dose for somebody. Excuse me. So we don't know what that is actually. Hold on a minute, everyone. I'm sorry. I got to make sure that my computer does not ring here again. All right. Sorry about that. Anyhow, let me go back to what I was saying. Okay, so disulfiram, everyone, as many of you know, is a drug that we historically have used to treat alcoholism, but has been shown to have some good benefit in treating what is known as persister Lyme. And persister Lyme is a form of Lyme that goes into hibernation, and when it's in hibernation, doesn't respond to the standard antibiotics. So we need to find something that's not a standard antibiotic to kill it. And disulfiram was discovered to do that. This was discovered maybe about a year and a half or 2 years ago in laboratory experiments. And last year in May, a colleague of mine, Dr. Liegner, published a paper documenting his experience trying this medicine with 3 people in his practice. Okay. And he reported some positive findings, and subsequently he presented more information to all of us that attended the last International Lyme Disease meeting. And there he showed that of 31 people that he's had it on now, he's been able to get 6 into what he calls extended remission. He's had about 5 or 6 that had to stop because they couldn't tolerate side effects. And then there was another group that got good improvements. Okay, so most of us are using this now to treat persister forms of Lyme. In terms of what is the right dosage, we would actually need to have studies where we take humans and we see what happens. There would be dosing studies, okay? And those haven't been done. The only experiments we actually have are Petri dish experiments. We don't have human experiments telling us what is the best dose to use for somebody with Lyme. They haven't been done. And so Dr. Liegner had come up with the idea to dose this based on weight. And so I've incorporated those recommendations into what I suggest. And that's because he found success with those kind of doses, and a lot of my colleagues have too. But the truth is, we don't know the ideal dose. So what the ideal dose is what works for you, okay? So if you are not able to get up to that 750 milligrams, then working at 375 milligrams or working at 500 milligrams may be successful in you. And so ultimately, you got to be able to take what you can tolerate, okay? And so I have had some people that I might have a target dose of 500 milligrams based on their weight, but I'm only able to get up to 250 milligrams and they do great. I've had a number of people that have done well even at lower doses when we're not able to get them up to this preferred target dose that was developed by Dr. Liegner. Okay. All right. So I hope that answers your question, and thanks for, and so thank you for that, everyone. I'm going to do a quick screen share because you may be wondering where is this chart that where I wrote down targeted dose range for people. Okay, so I'm going to do a quick screen share here. All right, let's see here. Okay, so this is my supplement store. Many of you know that any supplement I recommend in any of my articles, or when I talk about supplements, if you're looking for a good quality source for those in terms of products and brands, take a look here, okay? This store is for my existing patients, but it's also for anyone. Anyone can order from my store. So for instance, I put out a new article earlier this week on how to treat Bartonella, and one of the recommendations is using oregano to treat persister Bartonella and to treat biofilms in Bartonella. And I got a lot of emails back asking, what is the product I recommend? Well, you can find it here. Just type in oregano and you will find the article that the product that I recommend for that, okay? All right, so let me go over here. This is my Lyme disease information site called Treat Lyme by Marty Ross MD. Many of you are familiar with it. Take a look at my online Lyme guide, and let's see, we're going to look in, I think I've got an article here. Okay, so this is my article on disulfiram. It's called, and so you could literally just write disulfiram up here in the search bar if you want to. But down here in this section, I actually put a targeted dose range for people to think about. Okay, all right. And so this is something we're all still learning about. It may be in the end, maybe we don't have to use doses this high with people. Okay. All right. Very good. Thanks for that question, Tim. Good luck to you. Oops, I guess we did. I'm trying to get rid of that question, Tim. Hold on here a minute. Let's see. Get rid of that. Okay, there we go. Hold on here. Got somebody that wrote a question twice here. I'm trying to get rid of one copy of it. All right, here we go. Hello, Tony. Let's see. Hello, Dr. Marty Ross. I hope that you are doing great. I am. Thank you. I'm curious to know if disulfiram is effective against Bartonella and Babesia. And if not, would it be possible that when disulfiram gets rid of Lyme disease, that the immune system is strong enough to fight Bartonella and Babesia on its own? Thank you. All right. So disulfiram does have some anti-malaria properties, meaning we use it for malaria. And malaria is a parasite that acts pretty similarly to what Babesia does. So when we design treatments to treat Babesia, we generally use antimalarial agents. So it could help with Babesia, although I would not use it as a single agent or the main agent, okay? I don't find that it is strong enough on its own, for instance, to get rid of Babesia. And then in preparation for rewriting my Bartonella article that I was just telling you about, I actually started looking at a lot of the science about agents that could be used to kill Bartonella. And actually, laboratory experiments would suggest that disulfiram is really not that useful to treat persister forms of Bartonella or even biofilms in Bartonella. And so I wouldn't think of it as being a useful agent for Bartonella. I know I've told people before that the jury's kind of out, but when I started, meaning many of us that are working with it clinically are not sure if it's helping our Bartonella patients or not. But when I look at the laboratory data about how effective it could be against Bartonella, it doesn't look that promising, actually. All right, so I would not use disulfiram to get rid of Bartonella. All right. Now, you raised the question, could your immune system, if it wasn't suppressed by having Lyme in you, potentially deal with Bartonella and Babesia? It's possible. Our immune systems can deal with germs. In fact, there's a lot of people out there, I think, that have been bit by ticks and they got Lyme, but they never had to do anything to get rid of that germ because their immune systems took care of it. Meaning they didn't have to take any antibiotics, herbal or prescription antibiotics to get rid of it, okay? So our immune systems, when we get out of the way and we get rid of those things that block it, may be able to deal with infections like Bartonella Babesia. Having said that, I suspect that you probably will need to take something like an herbal or prescription antibiotic to deal with those. The chances that if you're already sick with those infections, the chances that your immune system would be able to stand up and take care of them once you get Lyme out or under control is actually probably pretty small at this point, okay? All right. I don't mean to discourage you, but I'm saying the odds are probably you're going to wind up having to take something for those. All right. Thanks for that question, Tony. Hello, Justin. Let's see. Greetings, Dr. Ross. Thank you for your time. You're welcome. Let's see. I completed the Babesia, Barton, and mold illness protocols. Feel a little bit better. Gene test, DNA, RNA expression says I'm no longer mold or Lyme reactive. A hair sample test says mercury and aluminum toxicity, so I am starting chelation with DMPS and ALA. High tryptase levels of 13.9, tried Claritin, got worse. Weak, tired, and anxious all the time. My eyebrows are also thinning, but my ferritin levels are normal. What's your take on the Genie test? Any suggestions on what to do besides chelation? Thank you so much, Justin. Okay, so first of all, the genetic genie is not going to tell you whether you actually still have active Babesia or Bartonella. Genetic testing doesn't prove you do or do not have those, okay? Also, genetic testing doesn't prove whether you actually still have mold toxins trapped in you. It just says whether you have the ability to maybe handle those mold toxins or not. But even if the genetic test says you're supposed to be able to handle those mold toxins, meaning your immune system is set up to remove them when it sees mold toxins, that doesn't always take place. You can have normal genetic profile of a system that should be able to handle mold toxins, but they may still get trapped in you because genetics only give us part of the story, okay? So if you're trying to see if you actually still have mold toxins in you, the best way to see if you have mold toxicity, meaning mold toxins are trapped in you, is to measure the mold toxins, not the genetic profile that says whether you might or might not be able to deal with mold toxins, but actually go to the true source and see, do you have mold toxins in you, okay? Because if you do, then it means you still need to do more to remove them. And so I like getting urine testing for that from one of two labs. The two labs I like to use, one is called Great Plains Lab out of Kansas City. It's their urine mycotox test. The other possibility is to use real-time labs out of Texas. Either one of those labs, I have good success in dealing with them, and I trust their results, okay? All right. In terms of Babesia and Bartonella, the only way to really know if they're gone, testing doesn't totally tell us if they're gone. We don't have a done test for Bartonella and Babesia. You got to look at your symptoms. And if you have a lot of symptoms that still look like Babesia, then you probably still need to keep treating it. And if you have a lot of symptoms that look like Bartonella, then you probably still need to keep treating it, okay? And I'm not going to go through the list of those symptoms right now, but I will show you an article that you can take a look at on both of those to see, do you have a lot of those symptoms or not, okay? All right, then finally, one comment about hair testing for heavy metals. That is not what I would call a reliable form. And let me, at least in my practice, now other people may have different opinions on that, okay? Because our science here is not the greatest, all right? But when it comes to heavy metals, what we're concerned about, what I'm concerned about, is what gets trapped inside of your cells, all right? So if we breathe in, drink in, eat in a heavy metal like aluminum, lead, mercury, those are heavy metals, okay? What can happen is most of them will get absorbed into our bloodstream, and the majority of them we're going to pee out. We're just going to get rid of them, okay? But some of them will get stored inside of our cells. And what happens inside of our cells is they're attracted to where we have lots of sulfur. And what's rich in sulfur in our cells are the energy factories in our cells called mitochondria. So mitochondria is where our cells burn sugar and burn fat and create them into a type of cell fuel, which is called ATP. Those chemical reactions that convert sugar and fat into cell fuel require enzymes to make them happen. And those enzymes are all rich in sulfur. So what happens if you get heavy metals and they migrate to where sulfur is, effectively they're binding up the sulfur on these enzymes, making the enzymes not work well. So you get sluggish energy generation. And keep in mind, mitochondria are found in every cell. So if your cells in the body are not getting enough energy to function, they're not going to work well. So your immune system may not work well. You will have low energy because your mitochondria aren't working well. Your brain may not work well, all right? So what we're most interested in finding out is what's in your cells, all right? Now, there's three ways we can test for heavy metals. We can do a blood test, we can do hair analysis, or we can do urine testing after you first take an chelation agent to pull those heavy metals out of your cells, all right? So blood testing probably is most reflective of what you've been exposed to over the last 24 hours or so, okay? Hair analysis gives you an idea what you might have been exposed to over the last 3 months, depending on how long your hair is, maybe 6 months, okay? But it doesn't tell you what's built up over time. And so what the issue is with heavy metals is once they get in your cells, they have an elimination half-life of 23 to 24 years. All right. What elimination half-life means is the amount of time it takes for half of what gets in you to work its way out on its own. So that 23 to 24 years means you could have a bunch of small exposures over a lifetime that build up to a pretty significant level inside of your mitochondria and inside of your cells. All right. So I want to know what that is. Okay. And so the way you do that is you take a chelation agent like DMSA or like EDTA or like DMPS. These are prescription pharmaceutical chemicals. Okay. And you take a certain amount based on your weight, and then you pee for 6 hours and you collect your urine. And what those chelation agents do is they pull the heavy metals out of your cells so that we have a better sense as to whether you're pulling an excessive amount out compared to other people in the population. Okay. And that's how I make my decisions to treat for heavy metals, based on what's in the cells actually. Okay. So anyhow, those are just some comments that I have for you. I hope that gives you some insights and some things to think about. Okay. Oh, let me do a screen share to show you those 2 articles that I told you about for Babesia and Bartonella symptoms. All right. So this is back at my Lyme disease information site. I'm going to take a look at the chapter on detoxification. Actually, no, I'm not going to go there. Well, actually, the reason I was talking about that is I've already recorded an article about how do you check for heavy metals. You can find that in the detoxification chapter. But in terms of symptoms, take a look at this section called How to Diagnose. And this is the article I've written about how do you diagnose Bartonella. It's based on symptoms. And the same symptoms I indicate here are what you would use to follow to see if you're getting rid of Bartonella. Okay. And then this one down here is called How to Diagnose Babesia. And in here, I have an extensive list of symptoms that you would look for that indicate Babesia could be active. And as you treat, you want those symptoms to go away. Okay. All right. Thanks for that question, Justin. Good luck to you. Hello, Megan. Let's see. Hello, Dr. Ross. Ever since I started treating Lyme and Bart with either herbal or prescription antibiotics, I have developed these tiny acne-like bumps all over my abdomen and up my arms. I used to have very smooth skin, and it has gotten progressively worse over time with treatment. If I don't detox regularly, the additional bumps can get prickly. It looks similar to keratosis pilaris, but isn't just on the backs of my arms. And my thyroid is in great shape. My zinc is adequate. I take 3 omega-3 fatty acids daily and eat plenty of vitamins. A precursor beta-carotenoids daily, so I don't see how it could be hyperfollicular keratosis. I know I have a yeast problem. Could that be it? Thanks so much for all you do. Yeah. So a couple comments, Megan, and I think you have some good insights there on the end too. So first of all, if you have used cat's claw as part of your herbal regimens, cat's claw has a slight, in some people, not everyone, in some people, has a slight estrogen effect, which can lead to the kind of bumps that you're describing, okay? And that can get better if you just come off the cat's claw and substitute something else for it, okay? All right, so that's just a comment, okay? All right, the other thing that I see in my practice is that if you have too many yeast in your intestines, it can lead to a variety of skin rashes, including things that kind of look like pimples but aren't fully pimples, okay? So what we know about yeast is yeast makes everything skin worse and can result in these kind of pimply rashes like you're describing. And we think it's due to toxins that get produced by the yeast overgrowing in your intestines. They get absorbed into your bloodstream. And there are certain people with genetic predispositions or genetic programming that makes it so that when those yeast toxins interact with their skin, it can result in rashes and even pimples or pimple-like rashes as well too. And I suspect that's probably the greater chance of why this is happening with you, okay? So in terms of determining if it could be yeast, let me show you an article that you can go through later that gives you the tools to figure out, do you have too many yeast, okay? All right, everyone. So back at my Lyme disease information site again, take a look under my section on yeast. And to try to see if you are having a yeast problem, take a look at this article called Yeast, a Silent Problem, okay? All right. And then if you do, if you're looking for options that you can use to get rid of those yeast, including herbal and prescription options, take a look at this article called Kills Yeast, a Brief Guide, okay? All right. Okay. All right. Thanks for the question, Megan. Good luck to you. Hello, Patty. Hold on here just a minute, everyone. Hello, Dr. Ross. In February, I started minocycline and the Cowden herbals. I experienced extreme dizziness, which did not subside over the course of a month, so my doctor switched me to doxycyline. Dizziness improved, but because I showed no improvement in other symptoms after 2 months, she switched me to clarithromycin, ceftonir, and nystatin. The dizziness persists, and she stated that I could back off the herbals and antibiotics for a short time to see if the dizziness improved. Unfortunately, after a week off of them, I still experienced dizziness. The doctor says dizziness could possibly be caused by die-off and I should persevere. What is your opinion on this? Thank you so much. Okay, so let's talk about a few things about dizziness, all right? Because different people mean different things by dizziness. So there is a type of dizziness, which is what we call vertigo. Vertigo is a feeling like you're spinning or that you're in motion or that you're on a merry-go-round, okay? That is usually involves a part of your inner ear that controls balance and can sometimes be brought on by infection or injury to your hearing nerve, basically, okay? All right, that's vertigo, okay? All right. Then there's another kind of dizziness that people describe, which I call more of a cloudy or lightheaded type feeling. Okay. And so I'm not sure which of these you're describing, but I just want to make a distinction. Okay. Now, the vertigo kind of spinning type dizziness usually means some kind of nerve injury or inflammation. I do not see it as a Herxheimer type symptom or a killing reaction type symptom, okay? If you happen to have a dizziness that's more of a cloudiness or lightheaded kind of symptom, that can sometimes be from a killing reaction. And what happens is as we're killing germs, our immune system sees those dead bug parts and reacts by making more inflammation chemicals made by white blood cells called cytokines. And cytokines are good and bad. And on the one hand, when the immune system sees germs or toxins in us, it will manufacture cytokines, all right? And the purpose of those cytokines is to turn the immune system on. But if we're having a hard time dealing with those problems, or if we make a lot of cytokines because we're having dead germ parts in our body and our immune system sees those and starts making more cytokines, excess cytokines can cause problems. And excess cytokines give you most of the symptoms that we call Lyme symptoms, okay? So they can make you feel lightheaded or cloudy, dizzy, okay? Or they can make you hurt all over. They can make it so your brain doesn't work well. They can give you severe fatigue. Basically, anything we call a Lyme symptom is due to excess cytokines. And as a result of seeing all those dead germs, when we start killing Lyme germs, when we start antibiotics or change antibiotics, we can sometimes cause cytokine surges, which will make lightheadedness, cloudiness, kind of dizziness worse, okay? If, on the other hand, what you've got is a spinning kind of dizziness or a vertigo kind of dizziness, and it's not getting better by changing the antibiotics, you may want to actually be evaluated by an ear, nose, and throat doctor to see if you actually have an inner ear problem. There sometimes are physical therapy moves that they can do that can correct that problem as well too, okay? And then one final comment. Minocycline is a side effect is notorious for giving dizziness. Well, it doesn't happen that often, but it can about 5% of the time. People can get dizziness, which is usually more of a cloudy, lightheaded feeling, okay? But if your dizziness is one of motion and it still has been going on for a while, I would consider seeing if your doctor will refer you to an ear, nose, and throat doctor for further evaluation of that, okay? All right. Thanks for that question. Good luck to you. Hello, Sarah. Let's see. Hello, Dr. Ross. Thanks so much for taking my question. You're welcome. Let's see. I currently have a clinical diagnosis and am being treated for Lyme, Babesia, and Bartonella. I recently traced back the date of the only tick bite that I'm aware of I've had to when I was 6 months pregnant with my daughter. I did not get antibiotics. I developed noticeable symptoms for the first time when she was 14 months old. She is now 20 months old and is a healthy, happy child. Has had all of her vaccines reaching her developmental milestones. She was only breastfed half the time for maybe 3 to 4 weeks due to low production. My Lyme literate medical doctor says if she is well, do not test her and focus on getting myself healthy. Would you agree or disagree from your experience? If she has the germs, would she be asymptomatic by now given, or be symptomatic, I should say, by now given infants' immature immune systems? Is there anything I can do to help prevent her from becoming symptomatic? Thank you. All right. So first of all, it's an interesting question, and I have to deal with that with a number of my patients as well too. And so what I'm going to tell you is the approach I take with them. So first of all, the chances that your baby could have picked up Lyme from you during pregnancy is about 50%. Okay, that means there's a 50% chance that your baby never got the infection from you. All right, so there's a 50% chance it did not happen. Okay, all right, now if you so that's one thing. Okay, secondly, the reason that we use antibiotics in somebody that has Lyme disease is to basically help them feel well. Okay. And we use those antibiotics at some risk. All right. And the risk of using antibiotics is that by using antibiotics, we may get into side effects of those antibiotics, but we also can do quite a bit of harm, potential harm to the gut microbiome, the good bacteria and germs that make up our intestines. Okay. And there's a whole body of science that's starting to come out now suggesting that gut microbiome is really important to us. All right. That gut microbiome, we know, helps with digestion. We know it sends out various signals that regulate the immune system. We know it's involved in detoxification. It's involved in removing things we might be allergic to. Okay. There's a lot of stuff our good bacteria does. All right. So because of that, because I use antibiotics only to get a person well, I generally will never use antibiotics in somebody that is well, even if their testing is positive, because I don't want to do anything to mess up the gut. Okay, if I don't have to. All right. Now, if you have active Lyme, it makes sense. Sometimes you got to mess up the gut, but I don't like to do it. So first of all, if your baby is well, just because even if it came back positive, I would not necessarily want to mess up the gut. I wouldn't want to do it. Okay. Secondly, another comment, if your baby's test does come back positive and she has no symptoms, there is a good chance it could be a false positive test. All right. So testing for Lyme and its ability to predict if Lyme truly is in you increases with the more symptoms you have. Okay. The predictive value of a positive test, that's something we use in medicine, a term called predictive value. The ability for a test when it's positive to truly tell you that that problem is happening in you goes up, increases the more symptoms that you have, okay? If you have no symptoms, there is a big chance that the testing could be a false positive, okay? All right, third comment. In terms of even if let's say that your test came back positive and your daughter had Lyme or still has Lyme in her, there's a concern I have that when we use antibiotics, in addition to disturbing the good bacteria in the gut, that we could, by using antibiotics, possibly trigger that germ to kind of become resistant to those antibiotics and maybe even stronger, leading to the development of Lyme disease. All right. I have no evidence of that, but I sometimes wonder if that is a possibility. So there's 3 reasons I really don't like using antibiotics in a child that is healthy, even if they were to have positive testing. And I just went through those. 1 is we don't want to destroy the gut microbiome. 2, it could be a false positive test. And 3, even if it really was a germ in there, we don't want to do something to suddenly trigger that germ to become more virulent, okay? All right, one last comment. We can cohabitate with germs. Some of us may have Lyme living in us that just doesn't cause us any problems, all right? And just because a germ is in you doesn't mean it leads to disease, all right? It may mean your immune system is doing what it's supposed to do, which is keeping that germ under control. We know that other germs like Mycoplasma pneumoniae and Chlamydia pneumoniae and human herpes virus type 6, which is a respiratory virus, and cytomegalovirus and parvovirus B19. These are an Epstein-Barr virus, the monovirus. We know that these are germs that live in healthy people, and what healthy people do, their immune systems keep them under control. We don't try to eradicate them, partly because we may not be able to, but also their immune systems are doing what their immune systems are designed to do, which is take care of the germs, okay? And taking care of the germs sometimes means just walling it off, making sure that it's kept under control so that it doesn't bother us, all right? So those are some comments. I hope that gives you some useful information, all right? Good luck to you. Cynthia says hello. Hello, Cynthia. Hello, Brandy. Let's see. What is Morgellons, or your theory, if not known? What about other infections such as Pseudomonas and staph when the immune system is compromised from Lyme? What's good for panic attacks and palpitations from Bartonella? And what infection attacks the teeth? All right. So first of all, I'm not aware of any of the infections attacking the teeth. I am aware that some people, when they're under treatment for Lyme, do report that their teeth start to decay. And I'm not clear why that happens, but I am aware of that, okay? I think it has something to do with side effects or interactions with the antibiotics. In terms of panic attacks and palpitations from Bartonella, or increased anxiety from Bartonella. So first of all, I tend to think more of panic attacks. Huge swings in anxiety is coming more from Babesia. And I tend to think of palpitations actually coming more from Babesia too. So the one thing I would suggest you do is take a look at my article about how to diagnose Babesia and go through that symptom list and see if you've got a number of those symptoms and make sure you don't have Babesia, okay? All right, just humor me. I would do that, okay? Bartonella can sometimes trigger ongoing anxiety that's kind of with you all the time rather than full-on panic attacks. And sometimes as a result of that anxiety, you can get some adrenaline surging that will give you some racing and skipping of the heart, all right? So there's a number of things you can do. From an herbal standpoint, you can kind of calm that agitated nervous system by taking something called L-theanine. L-theanine is a component of green tea that's sold as a supplement. It's sold as a 100 milligram pill. And what it does is when you take L-theanine, it is converted into a chemical called GABA. And our brain is full of GABA receptors. And if you give more GABA to a GABA receptor, it can actually calm you down quite a bit. It can kind of soothe you, it can sedate you a little bit, okay? So a dose that you would use, it comes as a 100 milligram pill, and that's L-theanine, it's Theanine. Again, it's a 100 milligram pill, and you can take anywhere from 1 pill 3 times a day up to 3 pills 3 times a day. The more you take, the more sleepy you might get, okay? All right, that's one option. From a prescription, or the other thing you could try would be something called 5-hydroxytryptophan. Tryptophan is a building block for a chemical in our brains called serotonin. And if we elevate serotonin in our brain, it can have a calming effect too. In fact, prescription antidepressant, anti-anxiety medicines like Prozac, Celexa, Lexapro, Zoloft, those all work to raise serotonin as well. The way they raise it is they prevent chemicals in your brain from destroying the serotonin you make, okay? But another way you can raise serotonin is to take more of the building blocks so you make more. So serotonin can be quite calming. And if you were to use 5-hydroxytryptophan, also known as 5-HTP, it's a 50 milligram pill that you can take 1 pill 3 times a day. If after a week it doesn't seem to be helping, you could increase that to 2 pills 3 times a day. Okay. All right. The other thing, if that doesn't work, then you could start looking at taking prescription antidepressant medicines like the Prozac medicines I just mentioned. All right. Those can sometimes be soothing. And finally, sometimes for just the racing of the heart, you could take what a group of heart and blood pressure medicines called beta blockers. They literally block the adrenaline receptors that lead to racing and skipping of your heart. And one of those would be something called atenolol. There's something called Inderol, which is also known as propranolol, Toprol, metoprolol. You know how they all end the same letters, olol. They all end in OLOL. Any of those medicines are called beta blockers, and they can help at least with the racing of the heart symptoms. Okay. All right. Anyhow, I hope that gives you some useful information. You might want to talk to your doctor about this too to see what's going to be best for you. Okay. All right. Good luck to you. Hello, Alex. Hold on here just a minute. Good evening, doctor. We often hear about the benefits of curcumin in Lyme disease. That being said, is there also benefits to turmeric supplements? I brought some capsules recently. If there is, what dosage and when should we take the supplement? Thank you. All right. So curcumin is a component of turmeric, okay? And when you take turmeric, what is beneficial is the curcumin component of it. The dosing I use for turmeric is usually 500 milligrams 3 times a day. The only thing that you want to make sure of if you are taking turmeric is it's best if it is a liposomal variety, meaning that it's microscopically wrapped in fat. And it would be 500 milligrams of a liposomal variety 3 times a day. Could work just about as well as a liposomal variety of curcumin. So in theory, it could, okay? Anyhow, I hope that answers your question. Good luck. Hello, Spencer. Let's see. My wife finished her 9-month antibiotic course 3 months ago. Did a retest with Armin Labs and has got rid of Lyme, but she still has many of her symptoms, and the report indicated a result of Mycoplasma pneumoniae. Do you have any insight on how long it takes for Lyme symptoms to reside, or if Mycoplasma pneumoniae is common effect after? Okay. So a few things. I strongly disagree with any of my colleagues out there that are using Armin Labs to determine if treatment is done. All right. There is no existing lab that proves the germ is out of you. There just isn't. Let me talk a little bit more about that. Okay. So Armin Labs uses a test technique called an Elispot. And what an Elispot is measuring is whether a type of white blood cell that fights infections called T white blood cells. The Armin test is seeing if your T white blood cells have attacked Lyme or seen Lyme or whatever germ they're testing for sometime within the last 2 months. In theory, that's what it's testing for. All right. So what the test does is you draw blood from somebody and you take their T white blood cells. And then you, in a test tube, you add to that test tube proteins from Lyme germs. And you see if these T cells react by making a group of cytokines. Remember, I mentioned cytokines earlier tonight, okay? So it's a T white blood cell reaction test. We're seeing if your T white blood cells react against Lyme that they somehow have seen in the last 2 months, all right? Okay, there's a problem though, and that Lyme can hide. It can hide in places it can't be seen, all right? It hides in a number of ways. Number one, it hides in tissues that have poor blood flow. So it could still be there agitating a person, leading to illness, but the T white blood cells may not see it because they can't see where it's hiding, basically, okay? All right. Second thing, we now know from good laboratory evidence that Lyme has the ability to survive by developing what are called persister forms or going into a persister state. All right, let me talk about that. So persister forms of the germ are non-growing forms. All right, so the majority of Lyme will exist in growing forms, that it's rapidly replicating itself and it's growing. But some Lyme germs, especially those that have been exposed to antibiotics for a while, will go into hibernation. They slow their metabolism way down. And when they're slow their metabolism way down, they basically can ignore antibiotics. In addition, one of the other things that happens in these persister states is the germs tend to cover themselves in a layer of slime called biofilms. Right? So a biofilm is a slime layer that covers germs. And these biofilms basically cloak the germ, hide the germ so the immune system can't see it. All right. So you could have Lyme still living in you and these biofilms agitating the body, creating illness, but in a way that the immune system can't react to it or will not have a T cell reactive positive test. It could still be in there. Okay. The other thing is you can have false positive T cell activation test. All right. So, and there is no other way of proving that Lyme is out of you. We just don't have that test because Lyme can hide in these ways that I just told you about, okay? So I disagree with doctors that do that. And I think, we as medicine always want to be able to have proof of stuff, but this is an illness that sadly enough, we don't have good ways of knowing a lot of stuff for sure, okay? So in my practice, what I do is I still follow the symptoms. And I don't follow T cell activation tests. I don't repeat Elispot testing. I look and see what is happening with my patient. Are they getting better or not? And if they're not getting well enough, I will likely continue to still treat. Okay, so that's what I do in my practice. Regarding the mycoplasma test, mycoplasma, and what I should say is using my philosophy in a situation where I get somebody that has seen a doctor that did an Armin test and it came back negative and they said, you're cured, you're done. And they're still full of symptoms and they come see me. We still keep treating and the majority of people will get better. All right. So I have evidence from just my clinical practice that they will get better. All right. And then finally, the mycoplasma is kind of a tricky germ and it's controversial. I also disagree with my colleagues that treat for mycoplasma. So mycoplasma is a common bacteria that lives in healthy people. And just finding laboratory evidence of it does not mean it's causing you a problem, right? It's one of those germs that we can cohabitate with. Just like we live with bacteria in our skin, we can live with some bacteria in us that don't cause us harm. And mycoplasma happens to be one of those germs. So there's some people I've looked at this. If you were to pull about 100 healthy people off the street, and you were to try to do testing to see if they have these germs in them, you would find in these healthy people, about 10 or 20% will have evidence of either one or more of Mycoplasma pneumoniae, Chlamydia pneumoniae, those are both bacteria, and the following viruses: Epstein-Barr, which is the monovirus, human herpes virus type 6, and something called cytomegalovirus. All right. These are healthy people. So we can assume the immune system does have the ability in a lot of people to keep these things under control. Okay. All right. One final point. Any of the antibiotics that we use that get into the intracellular space inside of cells, and when we treat Lyme, can also kill mycoplasma if it is a problem. All right. So those intracellular antibiotics are rifampin, doxycycline, minocycline, tetracycline, azithromycin, which is also known as Zithromax, and clarithromycin, which is also known as Biaxin. Okay, All right. So in a situation like this, I mean, I would need to know a lot more about your wife and ask her about symptoms and everything, but my inclination would be probably to keep treating. Okay. All right. Thanks for your question, Spencer. Oh, and if you do keep treating, you might want to make sure that they've added stuff that deals with persister forms of Lyme, like the drug dapsone or the drug disulfiram, this new anti-abuse medicine that we've used. There's other things you can do too. I'll do a quick screen share so I can show you what you do for persister Lyme. Okay, there's options. Let me do a quick screen share here. All right, so in Lyme disease, again, actually, why don't we just do it this way? I'm just going to type the word persister here. Okay, so I have a whole article that talks about persister Lyme and what works, okay? And take a look here. You'll get some insights into ways that I have found to approach it. And I gave you some thoughts on it. And I think even in here, I do have information about a drug called dapsone. I've got information in here about the disulfiram as well, too. Okay? All right. Good luck to you and to your wife, Spencer. Thanks for that question. Lois said, let's see. Will oral hyaluronic acid help with joint pain? Do any viral infections cause vaginal discharge? So hyaluronic acid, everyone, is one of the is a protein, I guess I would call it, that can be found inside joints. And it helps also with what's known as connective tissue, the kind of tissues that hold things together. It's not something I have found great success with. Usually if I've got people with joint pain, I'm going to try to get inflammation down using curcumin. I like using liposomal curcumin to do that. The Thorne product called Mariva 500 SF, 1 pill 3 times a day is my preference. The other things I sometimes will do is to try to support the cartilage in the joint and to rebuild the cartilage in the joints. And I'll use glucosamine sulfate as a 500 milligram pill 3 times a day. Now, be careful with your glucosamine sulfate. There's a lot of garbage out there. If you're going to do a trial to see if it helps, give yourself at least 2 to 3 months of taking it. And I would suggest using a Thorne product because it tends to be high quality. I would not trust the various brands you get at Costco. I would not trust the ones you get at Target. I would pay money to make sure that this is going to work. Now, if it does help, then try one of the lower cost brands and see if they help. But the problem with a lot of the lower cost brands and the things that are sold out there is there's been numerous studies done looking at are the contents that the manufacturers say is in those bottles in them. And a number of years ago, the New York Attorney General used DNA testing, genetic testing, to see if what was supposed to be in those bottles was in them, and found, I believe it's around 40 or 50% of products out there don't have what's supposed to be in them. They're not even there, even though they're supposed to be there, okay? In addition, in those New York, I think other DNA studies have shown that ingredients that weren't on the ingredient label actually showed up in these products, okay? So you got to be careful with supplements. And so if you're wanting to take the guesswork out of it and wonder what are good products, take a look at my supplement store, Marty Ross MD Supplements, where I try to take that guesswork out. I've curated what I consider to be high quality products based on their effectiveness, because I see that they work, and also from my discussions with the manufacturers, ensuring that what they say is in those products is actually in them. And yes, you're going to pay more for those kind of supplements, but don't throw your money away on stuff that's not going to work, or may even have harmful additives that aren't even described on the label. Okay. All right. That's why I run a supplement store. I run it so that I can make sure that my patients have the best chance of getting better, that I give them stuff that has the greatest chance of working. Okay. And anyone can buy from my supplement store. Now you may be wondering, where's my supplement store? I'm just going to do a quick screen share and show that to you. All right, so this is my supplement store. It's Marty Ross MD supplements. And again, through here, I have handpicked supplements for you that have the greatest chance of working. These are products that have a proven track record of putting in the bottle what they say is in there, and they tend not to put artificial fillers and ingredients in there that can harm you. And again, based upon the studies done by the New York State Attorney General and other independents, when you go to places like a Costco, actually they didn't look at Costco, but when you go to places like Target, they did look at Target and other places, you'll find that they found, I think, upwards of 40% of active ingredients that were supposed to be on products weren't even in them when you buy at places like that, okay? You get what you pay for, basically. Anyhow, anyone can buy from my supplement store, but I just wanted to show that to you. All right. Good luck to you, Sita. Oh, second part of your question. Do any viral infections cause vaginal discharge? Not that I'm aware of. All right. Good luck to you. Let's see. Hello, Tracy. Let's see. Hi, Dr. Ross. My daughter has been without Lyme symptoms for about 1.5 years, but she has gotten every viral infection that comes down the pike during the last 2 flu seasons and has trouble shaking them. Is it possible for Lyme co-infections to suppress the immune system in the absence of obvious Lyme symptoms? It's a good question. I don't know for sure. What I would tell you is usually if Lyme is there, it's going to show up as the other symptoms. It's not going to just show up as problems with immune suppression. Now, it is possible from having had Lyme in you, or also from just getting one virus infection after another, that the immune system does get beat down and needs to be resupported so it starts working correctly, okay? So things I like to do to support the immune system, when I've got somebody that I think is well, but they still keep getting repeat things, I know that those repeat things they keep getting probably that's what's suppressing the immune system. So what I like to do is try to reinvigorate the immune system. And the one thing I like to do is to use mushrooms. I like using reishi mushrooms. 400 milligrams 3 times a day can help support the immune system so it becomes more tuned up, if you will. The other thing you might want to look at is something called transfer factor multi-immune. It turns on a specific type of white blood cell called a natural killer cell and increases its activity by 600%. And that's a product made by Research Nutritionals. And the way that you take that is to take 1 pill twice a day, okay? So when I've got somebody in my practice that is coming in with repeat infections again and again, often it's because the viruses that they're getting, not Lyme, which is a bacteria, or the co-infections, which are all bacteria, it's not that they are suppressing the immune system, but rather it's the repeat virus infections themselves keep suppressing the immune system, okay? So you can bolster that back up. And usually what I'll do is I'll have the people that are like that is I usually will during the flu season, before the flu season starts, through the flu season, I will have them take for 4 to 6 months the reishi as well as the transfer factor multi-immune, okay? All right. One other comment. Generally, you can consider Lyme to be cured if you have no symptoms after at least 2 years, okay? It's 2 years. And that's based upon discussions with a number of my colleagues. Again, we don't have a true test to prove that somebody is cured. However, it seems that those that pass that 2-year mark don't go into relapses anymore. Okay? All right. Thanks for the question. Good luck to you. Hello, Mary. Let's see. Hi, Dr. Ross. How long do you have to take ketoprofen to reduce mast cell? Does ketoprofen cause weight gain, swelling after time? Do you feel mast cell really plays a part in improvement of chronic Lyme? So, everyone, there's a condition called mast cell activation syndrome, MCAS for short. All right. Let me talk about that real quick and then I'll try to answer your question. So, mast cells, everyone, are a type of cell that historically we in medicine used to think only were activated by having something land on them that you were allergic to. Okay. So, mast cells make histamines. And when a pollen or a cat dander, those kinds of things would land on a mast cell, they would release their histamines, and you get your itchy eyes, you get rashes, you get runny nose. Okay. What we now know is that mast cells also make a lot of cytokines, actually. They are cytokine factories. And those mast cells can be turned on to manufacture and release histamines more easily when you have chronic infections. All right. So Lyme can turn on mast cells. There's some good research showing that. And other chronic infections can turn mast cells on too. All right. So there's a number of things you can do when you have mast cell activation. All right. The symptoms, though, first of all, you got to figure out if you have it. All right. And basically, the symptoms that can suggest it are all histamine related symptoms. So people sometimes with mast cell activation get a lot of headaches from histamines. Sometimes they'll have a lot of watery, runny eyes. They'll have nasal congestion, stuffiness. They may react to a lot of foods or chemicals in their environment. They may have asthma that's gotten really bad. Okay, so you start looking for allergic type symptoms. There is testing that you can do, which measure things like histamine levels and measures something called tryptase, which is an enzyme that can be really high if you have severe mast cell activation syndrome. However, the testing is not reliable because you almost need to be in a full-on attack of this stuff before you can get a test to be positive. All right. And so many of us that treat Lyme are now aware that these mast cells can manufacture cytokines that keep you sick and also can manufacture all these histamines. So we will do things, if we see somebody that's very reactive or has a lot of allergic symptoms, we will start treating them for the possibility of mast cell activation syndrome. One of the frontline things that you can do is try to remove those things that you're reacting to, number one. Number two, de-stress, de-stress, and de-stress. Stress triggers activation of your mast cells. So if you have a person that has a lot of stress, you might want to look into meditation. You might want to look into riding your bike for 15 minutes if that gives you stress reduction. Okay, whatever it is that gives you stress reduction. All right. You might want to talk to a counselor. Whatever it is that you have found useful at de-stressing, you need to do if you have mast cell activation. Okay. All right. Number three, you need to take things that will actually stabilize your mast cells. And what I like to do for that, the main thing I like to do for that is a chemical called quercetin. It's a supplement. The other one I like to use is something called luteolin. Okay, those stabilize mast cells, so they tend to be less reactive. All right. Number four, I sometimes will add in antihistamines, and that would be things like Zyrtec or Claritin. Okay, all right. Now, and then the last thing I sometimes will add in is a chemical called Singulair that deals with the inflammation created by allergies, especially if I got someone with asthma. All right. And then last, well, not last, there's another chemical you can take that is a mast cell stabilizer that works on the gut. Sometimes people with all this mast cell activation get a lot of crampy abdominal pain, a lot of gassiness, and you can use a chemical prescription medicine called cromolyn for those kind of situations. Sometimes people also benefit by a slight antihistamine effect that anti-acid medicines like Tagamet have to give benefit also as well too. So you have to layer all these drugs on top of things, okay? All right. Now, if you do all these things, eventually the mast cell agitation calms down and you got to keep treating your infections that are stirring them up as well too. All right. Now, regarding the ketofen, I have to look something up here on that one. Bear with me just a minute. So the ketoprofen is basically an antihistamine, all right, which could work similarly to Zyrtec and could work similar to other antihistamines. I know it has fallen in favor that a lot of my colleagues use it. Because of the expense of it, I tend to go with the Zyrtec or a Claritin instead of using the ketoprofen. And the reason I was looking it up is I just don't use ketoprofen. So I am aware of it, but I wanted to refamiliarize myself with one aspect of it. That's what I was looking up. Okay. Do I think it plays a part in Lyme? I think, yeah, if you're a person that's a reactive person that has, and also has symptoms, a lot of nasal congestion, possibly watery eyes, a lot of skin rashes, things that really look like there's an allergic type component to your illness. Yeah, I think it can make a big difference. Okay. All right. Let me show you an article that you can read more about this, including more extensive testing that you can do that even list out some of these medications I was just talking about. All right. All right, so this is back at my Lyme disease information site. Just going to type in mast cell. All right, so this is my article on mast cell activation syndrome in Lyme. Take a look here for everything that I've written about it, okay, including some of the testing that you might do and the symptoms that fit with it as well, too, okay? So there's a whole section on how you treat it as well. All right. Good luck to you, Mary. Oh, Mary, one more thing. The reason I do treat for it, remember in my model of treating Lyme, if you've listened to my webinars for some time, or if you've read some of my information, you know that I think a key reason that people feel badly in Lyme disease is that their immune system overproduces cytokines. Okay. Cytokines are good and bad. On the one hand, they turn the immune system on when the immune system sees a toxin or a yeast or a bacteria, turns the immune system on to get rid of those. But on the other hand, in those situations, sometimes the immune system has a hard time and it keeps trying harder and harder and eventually can overproduce cytokines. Too many cytokines can suppress your immune system and give you most of the symptoms that we have called Lyme symptoms. The main reason I want to treat mast cell activation in somebody is those mast cells, as I was saying, not only produce histamines, but they dump a lot of cytokines out too. So I want to stabilize them so they're not overproducing all those cytokines as well. Okay? All right. Good luck. Thank you. Let's see here. Hello, Joyce. Let's see. Hi, Dr. Ross. Whenever I take herbs currently on Siddha Acuta and Hutania, I feel very internally heated within an hour or two. This has happened with all other herbs of Lyme and co-infections. Can you explain? Does this mean the germs are reacting? I can't explain it. I probably need to ask you a bunch more questions to figure out what other things happen too, but I don't have an explanation for that off the top of my head. It's an interesting symptom. Sorry you have that, but I don't have a good explanation for it. All right. And thanks for that question. Good luck to you. Hello, Dale. Let's see. So much appreciation for your work. Thank you. Let's see. Once took deep tub bath in methylene blue, have Lyme and all common co-infections, had forgotten it was possible to feel so good ever. Trying to see if there's another part to that question or to that comment. Well, I'm not finding it. Let me make a comment here real quick. So methylene blue that Dale mentions is a chemical that is manufactured mainly for IV administration. You can actually make it into pills though too, but you have to have a compounding pharmacy do it. Methylene blue historically is used for a hemoglobin problem. Hemoglobin is the protein that carries oxygen inside your blood cells. And there's a condition called methemoglobinemia where the oxygen becomes too tightly bound to the hemoglobin and it isn't released into the tissues, and people literally turn blue because they're just not oxygenating their tissues, okay? And so the treatment is this chemical called methylene blue, which ironically makes you pee out blue. But methylene blue causes the hemoglobin in this situation to release its oxygen, all right? But what's interesting is in the current world of research that's being done, trying to figure out what do we do for these persister forms of Lyme and these persister forms of Bartonella, because we now know that Bartonella can form persisters, that methylene blue in Petri dish laboratory experiments is showing that it has the ability to we think it destabilizes the membrane, the covering of these germs, and makes it so that non-growing forms of the germs will die as well. All right. So methylene blue is getting some attention. In fact, I wrote about methylene blue as one of those things you can do to treat persister Bartonella. For those of you that are not aware, I did produce and create a new article that I sent out by email 2 days ago. I'll just show it to you here real quick so you can take a look at it later. And it's on updated approaches to managing Bartonella based on the fact that Bartonella can we now know, create biofilms. And in addition to biofilms, Bartonella has the ability to form persister cells. Traditionally, most of our treatments have been focused on treating growing forms of Bartonella germ. But in this new article, I describe what you can do to treat Bartonella that's in persister forms and in biofilms. Let me just type it up here. So it's my article called Kills Bartonella, A Brief Guide. And this is the new version of it. And so I just published this yesterday, but it's a complete rewrite of the article to acknowledge that Bartonella we now know forms biofilms, and we now know forms persisters. And in here, I talk about using methylene blue as one of the things you can do. Okay. All right. Thanks for that question. Hello, Cynthia. Good evening, Dr. Ross. My husband and I have chronic Lyme for 1.5 years and have been treated since. We would like to start a family. What are the chances of transmitting to the fetus? Should we wait to start trying? Thank you. All right. So here's what we know. We know that if Lyme is in you and active, that there's a 50% chance of transmitting it. All right. That's what we know. How we know that is based on a couple things. Number one, there was a pregnancy registry kept out in Connecticut in the United States in the late 80s and early 90s. And in there, women that had Lyme during pregnancy allowed information to be kept about them, and information was collected about their babies afterwards too. It wasn't a true research project, but it was an information gathering tool. Okay. And in there, we know that women that had Lyme 50% of the time would transmit it to their babies if they were not on antibiotics at the time that they had it. Okay. Now, what we don't know based on that data is if there were any woman, I haven't been able to see the data. It's reported. Okay. I don't know if there were any women in the group that had transmissibility that had no symptoms of Lyme. All right. So what the wild card is here is no one knows for sure that if you have Lyme and you're asymptomatic, but the germs still remain in you, is there a chance of transmitting in that situation? And the truth is, we don't know. We don't know. So usually what I'll do with patients of mine that are considering whether they want to get pregnant or not, or what to do during pregnancy, is I'll have a discussion with them. I'll say, if you have a lot of symptoms, we know from data, probably there's a chance you can transmit it. If you're not having a lot of symptoms, we do not know for sure from data whether you can transmit it or not. But if you want to be very safe, you may want to take antibiotics. But you have to weigh that out against the risk of altering your baby's gut microbiome, because these are going to get over to the baby and the baby's gut microbiome is going to be changed. And do you want to take that risk? Okay. There's just a lot of uncertainty in this decision. Okay. Good luck to you. Let's see. Hello, Diane. Let's see. Which antibiotics can be used for Lyme carditis and which herbal treatments? Can you use both at the same time? And which would be used if it is caused by Babesia and or both? Thank you for all you do. Much appreciated. So, Diane, any of the prescription antibiotics I've written about in my Lyme antibiotic guide could be used, and same with any of the prescription medications for the Babesia carditis could be used as well too. Okay, all right. Probably of the Lyme antibiotics, IV antibiotics like ceftriaxone might be useful, but also oral doxycycline can be very useful as well too. In terms of herbal antibiotics, we just don't know. I don't have any studies that say whether they work well for Lyme carditis or not. And in these situations, I would tend to err on the side of actually using prescriptions, because we know that they have more of a proven track record of working in these kind of really sick situations. Okay. All right. Thanks for that question. Good luck to you. Hello, Nico. Hold on here just a minute. Hello, Dr. Ross. I was diagnosed with Lyme in 2017 and was treated with antibiotics for 1.5 years. 3 months ago, I got an eye floater suddenly in my right eye. No pain associated, but I also felt like having a thin saran wrap covering 1/3 of my right eye. My ophthalmologist examined twice and no serious problem was found. He said it was an age-related issue. A couple of weeks ago, both eyes suddenly started swelling with itchiness. So I went to a different ophthalmologist. He examined, but the result was the same. No serious problem found. He gave me neomycin ointment. It is better, but I still have the floaters and a strange saran wrap around my right eye. The second doctor, who is also an oculofacial plastic surgeon, highly recommended a Botox shot in my forehead to ease wrinkles if I am interested in. He said it's quite safe. Question 1, is there any possibility that my eye floater is Lyme related? And 2, is Botox shot really safe for people who have had Lyme? So I don't find any contraindications to doing Botox. I haven't seen anyone have harm from doing it. Okay. All right. In fact, I have a number of patients in my practice that have severe ongoing migraine problems, that the way we manage their migraine problems is with Botox. And I don't see any harm in other Lyme symptoms or any of the other germs that we're treating. Okay. All right. In terms of the floater, yeah, floaters can sometimes occur in Lyme, but they occur for many other reasons too. So having floaters is not proof that you have Lyme. All right. I think I answered your questions there. Yeah. All right. Good luck to you. Thanks for your question. Hello, Z. Please talk about methylene blue together with other meds, with disulfiram, with herbs. Which herbs? Dose of methylene blue, duration of treatment. All right. So methylene blue, again, I mentioned earlier tonight, is a chemical that we use to treat a oxygen carrying problem of hemoglobin, where hemoglobin doesn't release oxygen, and giving and causing something called methemoglobin, where people turn blue. Okay, and methylene blue was designed to help treat that condition, and it does. We now also know that it has some antibiotic properties, and we think that the way it works on germs is it can target non-growing forms of germs by destabilizing the covering of those germs. It can actually, at least based on some of the petri dish experiments I've seen, can treat growing forms of germs as well too. All right. All right. So in the world of Lyme disease, we are interested in looking at methylene blue because it's an agent that can treat non-growing germs, which are what we call persisters. I mentioned that earlier tonight. Persisters are germs that basically, for some of the Lyme germs and some of Bartonella, have the ability to go into hibernation and ignore standard antibiotics. It appears that methylene blue has the ability to destabilize their membrane and kill them. Okay, so we're using methylene blue to treat persisters. All right, we do not have human studies yet about whether this is something beneficial in humans. What we do know is that based on research that was done out of Johns Hopkins University by a physician named Ying Zhang, Dr. Zhang is a doctor that formerly worked in the world of tuberculosis and converted his lab over to focusing on Lyme disease a number of years ago. And the relationship is tuberculosis also is difficult to treat, takes sometimes 9 months or more with multiple antibiotics, and has persister cells. So Dr. Zhang thought he would take some of his experience there and see if he could start helping over here in the world of Lyme disease. And over the last 2 years, he's published a number of petri dish experiments. And the first set, he was mainly focused on looking at Lyme disease and things that could treat persisting forms of Lyme. And those studies that came out about 1.5 years, 2 years ago showed that methylene blue is an agent that can kill persisting Lyme. Okay. More recently, he has turned his attention in 2019 and 2020 into looking at Bartonella and the reason why some people with Bartonella have a hard time getting better. And he's been able to show in his laboratory experiments that Bartonella can form biofilms and Bartonella can form persister cells. And he's able to show in his lab that methylene blue is an agent that can remove biofilm and can also treat persister forms of Bartonella. Okay, so that's what I'm using it for now. I'm using it as an agent mainly to treat persisting forms of either Lyme or of Bartonella. The dosing that many of us are using, and again, we just don't have human studies to even show that this stuff really works. Keep in mind, these are laboratory experiments, and what happens in a laboratory experiment doesn't necessarily mean it's going to have any benefit a living human, okay? But many of us, many of me and my colleagues are starting to work with methylene blue, and the dosing that we're using is 50 milligrams twice a day. It is possible to even go higher than that, but 50 milligrams twice a day. How long can you use it? Indefinitely. We don't know that there's any end date in that. And can you mix it with herbal medicines and prescriptions? Yes, you can. Could you mix it with disulfiram? I don't see a problem why you could mix it. I'm not aware of any reason you could not mix it with disulfiram. Okay. All right. It needs to be made by a compounding pharmacy because off the shelf it's just made for intravenous administration, and we use it that way for people that have really bad methemoglobinemia. Okay. So it needs to be made by a compounding pharmacy. All right. Thanks for that question, Z. Good luck to you. All right, everyone. So that is it for me for tonight. And that's actually it for the next 2 weeks. So next week I won't be doing a webinar. I'm going to take a break from it. So I'm back to writing articles, everyone. So for those of you that are signed up for my newsletter list off of Treat Lyme by Marty Ross MD, you got an email yesterday talking about this new article on Bartonella. Next week, I will be releasing a new article on how to use Dapsone. It's an updated version of my old article, so take a look, keep your eyes out for that in my Treat Lyme newsletter, okay? Now, if you signed up for my webinars, that does not sign you up for the Treat Lyme newsletter. It's a separate email list that you can find at my website, all right? So if you want to be up to date on new things that I start releasing, feel free to do that. You'll start seeing, my goal is to release 1 to 2 new updated or brand new or updated articles a week. I'm back into writing again. It's good to be doing that. So keep an eye out for those, okay? And keep your eye out tomorrow morning somewhere around probably 8:30 or 9 to 9:30 Seattle time. look for the webinar recording to be released. And in that email that you get about it will be sign up for the next series of webinars. Okay. All right. Oh, finally, one last thing. If you are getting help from these webinars, share it, share information. Let other people know about these webinars so that they can participate too. My goal in doing this is to offer free help so that I can help people. There's a lot of people that need information about treating Lyme, and I love being able to do that. So help me reach more people. Your word of mouth is what spreads the information. Thank you. All right. Good night, everyone. And we'll see you again in a couple weeks. Bye-bye.